Excuse me. Oops, a burp. Okay, am I good? Am I good? It's all over the lash. It's beautiful. It's glorious. Knock knock. Anybody awake? Hello? Vic, is this you? Hello? Mickey? Is she talking? Or am I not talking? Hello?
Hi. Yeah, I had something in my throat.
It's no
Can you hear me?
problem. Milo here, Jay. I'm Dr. Milo. Easily enough, you may have met me previous. Basically, let me close this door. Basically, we're going to be your pre-op nurse or surgical assistant.
Right.
All right. If you have any
Aren't you a
questions,
psychologist? Right. Aren't you a psychologist? Are you
I'm
sure you're
merely an
qualified
assistant.
for
The
the...
doctor says do this, do this. Eh?
Right. Okay.
You're in good hands,
Okay.
beloved hands,
Right.
Mila. Well,
Right.
specifically the doctor.
Right.
You're right. Just hold your hair or something.
Uh-huh. Okay.
I have here a note. I'm going to read it out. It's basically a patient consent. I
Okay.
forgot to bring a
I'm
pen,
not...
so I'm going to be looking for verbal consent if that's okay.
Well, can I read it first? I'm not sure what I'm consenting to, because...
Well, I'm
Like,
going
I'm
to
not
read it out to
signing
you.
something I'm not... Okay.
It's patient consent for enucleation surgery. Enucleation carries potential risks, including, but not limited to, infection, bleeding, scarring, pain or discomfort, movement restriction of the prosthetic eye. You're getting a prosthetic, it's okay. I voluntarily consent to the enucleation surgery and any necessary additional procedures that may be required during surgery. And basically your signature, and the date is April 7th, 2013. And I am the witness.
Okay. Right. Generally, that sounds good. There's no fine print in there, like I'm selling my first
Yes, you
prosthetic
can look
or
yourself.
anything like that, right? Right.
The doctor has written the note. He's made a bit of a typo on the
Right.
date, but it's good.
Uh, right. Yeah, I consent.
Excellent. Have you taken any medications?
Well, yes, I've taken B190. I've taken, uh, some Meximin. There were some other random things that were in there, and I kind of took them as well. I think it was ibuprofen, and tramadol. And is that going to be a problem?
Should be no
That was
problem.
earlier, though.
You're not blood thinners, anything such as this? No frequent
Well, no. What
medication?
counts as a blood? What counts as a blood thinner?
I don't know, you might know. Well, it's this tramadol,
I
it's
guess not.
definitely a blood thinner. It sounds like you're good. You're good. I'm going to ask you to drink all of this. Okay?
Okay. What is it?
It's water.
Okay. It doesn't have anything else in it, does it?
No, it's purely to keep you hydrated. Because I assume that you've been not eating previous to surgery.
I ate some jerky earlier.
It's no problem. The doctor. It's a problem for the doctor, no, Mila.
So, I mean, I'm not gonna
Uh,
choke to death on. I mean, but what if I throw up and then I choke to death on my jerky vomit or something? I mean, jerky is like really solid, you know, so that would be a really easy thing to choke to death on.
no, I've seen Dr. Markov extract many different items from patient's stomach mid-surgery. So if you feel she needs to do surgery in your stomach, so be it. Which most likely no problem.
Oh, was that on the? Would that fall under the other procedures that might come up on the paper? Okay. Okay,
No,
that's fine. It's a
it's
simple
alright.
procedure, right?
Simple procedure.
Right? Right. Very simple, right?
I'm going to get the
Let's
change
bottom.
into this outfits.
Okay.
I will turn around.
Okay.
You let Mila know when you're
I
decent.
don't really. I'm never decent, but um, I will be clothed in a minute.
If you finish, Mila's no picking.
Mm, yeah, I'm pretty much done. I wasn't really
Excellent.
burdened with modesty though, so um,
Or doing with modesty. Maybe you should
yeah,
leave
no,
some of
that's
your
not a virtue
equipment
I was burdened with.
in the locker, in the bunker. I will look away. How you doing, prepping a patient. Are you decent, Mickey?
Uh, yeah, relatively speaking.
Excellent. We must collect some of your blood after we test it.
Wait, okay, I have a thing with needles.
It's no problem. Mila's got the cheat code for life. You just do a humming. If you go when it's happening, it's okay. It's no problem.
Alright, alright, I'll try that. People have tried that before, you know, they've like, you know, when you try to give blood and then the nurse is like, oh, think about, how was your summer? What are you doing this summer? And they try to distract you that way. That doesn't really work. But okay, I'll try
It's no
something.
problem. Alright. Just
Okay,
think of the birds.
that needles. Okay, think of the birds. Alright, that, okay, are you sure that you, I'm not gonna look.
It's no problem. It's just a test one. It's no problem. Think of the birdies.
Right,
Sky.
yeah, okay, think of the birds. All right.
Excellent.
There are none.
Okay.
Is that a bad sign?
You're O positive. Excellent.
Okay.
Right. No,
I mean, would it have been a problem?
you may keep looking at the
Something else?
birds in the sky or the
There are no
trees
birds.
in the hill. You're hearing not the tweeting?
I hear them, but I don't see them. Is that?
Well, I think they're up on the
Does
hill.
that mean something is wrong?
You should be
Okay,
looking at
that
the hill.
would
If you
distract
look
me,
in
so-
you're looking at the
okay.
hills with the birdies.
Okay.
Inside of the
That's-
trees, outside the bunker.
We're gonna think about-
Yantar's a beautiful
okay,
place.
think about-
Mila's been
No,
drinking
it's
lots of
definitely
coffee.
not.
It's
No,
a
it looks
beautiful
like a
coffee
crater.
morning. It's a beautiful crater.
Oh wait,
It's
why do I
excellent
feel
crater.
weird?
Yeah,
Oh my god,
it's
how
no
much blood did you
problem.
take? How much did you? That's a lot of blood. Okay, that is a lot of blood.
It's
You actually-
necessary.
how much-
It's instructions from the
You've been
Dr. Markov.
kind of-
It's okay. It's no problem. This
You
is
should
why
have
we're
written them down
outside.
first. You might have misread something.
And this
because
is
that
why
was-
we're outside.
I feel very
You've
lightheaded.
got plenty of air. You need to sit down.
I'm just gonna sit down.
You should sit down, Mickey. It's no problem. The doctor
Okay,
will
yeah,
be
it's
ready
not a
for you
problem for
soon.
you. You keep saying it's not a problem, but I mean, it's not a problem for you because you know, I'm sure this is normal. So.
It's just normal procedure. Absolutely no problem. This is Miller's first day as a surgical assistant. Absolutely no problem.
Okay, thank you. Right, right. Well, I mean, I did ask for your qualifications. I mean, I'm not a practice run, right?
No,
Right?
never. Yeah, we would never do a practice run with live meat. I mean, patient. Have you any questions for Miller? What about the fob?
Can I have my?
What's that?
Do I get my blood back after you're done with it?
Possibly. You need to ask Dr. Markov. He's the expert. I am just the put things in things and take things person.
Right. Because I was using. I mean, I was using it for so.
You're using it?
Uh,
You did not tell me. I asked you if you're on medication. You did not tell me you're on drugs. Illegal drugs. You're a user? What is your drug of choice?
I was using. My blood. I said I was using my blood.
Dr. Markov, are you ready for us?
Back after you're done with it, and I still don't know why you need that much blood.
Are you ready? Okay. Excellent. All right, Mickey. The doctor is ready for you. Follow me, please.
What about like, are you certified in like pathogen, like sterile techniques and?
Of course I'm certified in sterility. I have never had a child.
Should I,
Please follow Miller. Yeah. Okay, we're closing the door. Alright. Okay. In here, please. This is Dr. Markov.
Okay,
I'll be our consultant.
Hi.
Surgeon consultant.
Don't look at all the equipment, it's just I need all of it. So you're in very good hands. It is actually one of the lesser surgeries in terms of intrusiveness, so the chance of anything significant going wrong is quite minimal.
Okay, good.
As it is your left eye facing out, I'm going to have you lay down on that table. This is the optimal standing placement for me. You've got the firearm in the backpack with you.
Should I
put that away.
Wow,
Alright, let you put it away.
This is a sterile environment, and you've put non-sterile items all over the place when you sat down.
Oh God, did I ruin everything? Because I'm a brain infection
it's okay.
or something.
You won't get the brain infection.
Alright, I think the brain infection has come and gone.
What?
Don't worry about it. Also going to have you remove the face mask as well. It's not needed.
All right.
Especially considering.
All right, well, if it looks really bad, don't react too much because I'm very.
Not the.
It's no problem.
Stop!
Keep. She looks fine.
You give me no chance to. You give me no chance. You give me zero chance to accommodate himself. Anyway, doctor, that is what you're doing best.
Okay, just a few things before we begin. Given the non-intrusiveness of the surgery, you will not be put completely under with a full-fledged anesthesia. You put under local anesthesia, meaning you'll be awake during the entirety of it. There's an additional reason for this because there's a very minimal possibility that I nick the 17th cranial nerve, which is located directly behind your eye socket. In which case, if there's neurological damage, you would have to be awake for me to know this. But the chance of this is very minimal, don't worry. And I've prepared for everything that may or may not go wrong. Do you have any questions?
I'm sorry. What was this about the neurological damage part?
Well, given how I'm operating on your eye, and your eye is very close to your cranium, there is a chance that human error could occur, and I could nick the 17th cranial nerve, which is located right behind your eye socket.
Okay, well, like I was using my blood, I'm also using all of the nerves, so I need them not to be damaged.
That is the idea.
All right. Well, you don't have any like handshake problems, like you don't think you have developing. What if you're developing Parkinson's or something? Have you looked into that or something?
We don't, Millie. We don't even.
They have me go through before.
We don't even have a car park. There's no parking here. There's the garage.
He, this is his first day. He said he's never.
No, no.
He said this
Milo
is
has
his
done
first day.
No, as a surgical assistant. He's done plenty of other medical assistant
It,
duties.
Surgical.
It's very difficult to make a mistake on the duties he's doing. He's been doing very fine thus far.
right. Okay, well, did you see how much blood he took, though? Because he took a lot
How
of
much blood did you take?
Like, I'm feeling
Stick
really
the
lightheaded, so...
take the whole bag. That's like you recommended.
Yeah, I drank water. I just wondered if
And
that
she's
was what he was
fine.
supposed to do. If he read...
Yeah.
Alright, I'm sure...
She-
Told him to take out the blood bag full.
Okay.
It's operating under
Can you get
doctor
it back?
recommendation.
Well, this way, if anything were to go wrong, and then maybe I nick a major blood vessel, I will have blood on standby to give
Oh...
additional, as well as the saline I have here with me.
Okay, sounds good. I am glad that I'm not going to sleep, though, because I have kind of a control problem, so I was worried that I was going to have to
Kind of a what?
be completely... It's like a control problem. I have control issues, so I
She's
didn't
not
really
great
wanna
with
go completely
needles.
to sleep. And I don't like needles
Well,
either,
are your
but...
control
But we put
going
2 needles
to
inside of
be
her and she was
controlled during
fine.
surgery?
She's no problem. You're brave.
No. Yeah, no, it'll be fine.
She'll get a sticker if you're a good
Oh my god.
patient.
Well, she's going to get no risk of infection and a brand new
Or a brand new eye.
Is the goal here. Yeah.
You'll be qualified to drive again.
Yeah. Oh.
This is the prosthetic.
Oh god.
You're-
It is very realistic.
Doctor, you're showing in her peripheral
That's the
vision.
idea.
She cannot see it. To get it outside of her.
I can see it.
Oh, you turn it your...
Um,
Yeah, there, get the better look.
That is really realistic looking. It is
That is the
kind
idea,
of
no?
gooey, yeah. It is the right color.
It's
Yeah,
not
it's
glue, it's
directly-
just glistening. It's
Directly
oh,
copied from a Russian sniper. You will be able to hit the target at 500 meters. No scope.
I don't know about that. Very well.
Right, should I just
Do
look at
you-
the screen
Standard.
and pretend like the screen has something going
Well,
on, or?
Actually, Milo is going to have you. Milo is going to put up various images onto the screen, and you're going to have to look at exactly where he's telling you to look, because I sometimes need an eye to be looking in a certain direction. Because so you see, when was it again that did this to you?
The bandits.
Right. When they did that operation, it was not so clean. In fact, there's a lot of residual, damage there, which I'm going to have to eliminate today. But you see, some of the nerves are actually still intact. Therefore, when you look a certain direction with your functional eye, the nerves are actually moving on your non-functional eye, and we have to eliminate this because it can potentially affect the prosthesis implantation.
When 20/20 vision,
Okay.
not 20 and 15.
Yeah. Well, I suppose you'll have 10 out of 20 vision.
Well, true.
Very well.
Should clean it that screen.
So the local anesthetic is going to make it so you are still fully conscious during it. So what I'm going to do is go ahead and inject that in the operation area. I suppose, do you have any questions before we begin?
No.
Well, and I trust that Dr. Milo has explained to you the procedure.
No, not exactly. No, he just took blood, but
They can send for it.
Okay, well, I'm going to explain it as I go. How does that sound?
okay, that sounds good.
I suppose I'm also legally obligated to tell you that I've never done any surgery of this sort before. Or is it?
Okay, right. Uh-huh.
Yeah, but I studied it. And for the past week now, the procedure is not all that complicated, nor is it intrusive. If I mess up on any step, it won't be any significant.
It's not like you're losing an eye.
This isn't open heart surgery. This is implantation cleanup surgery.
Right. So it's pretty simple and low risk and everything. Like,
It's
I
low
already
risk.
explained to you the risk. There might be some discomfort
Wow.
afterwards. We're going to
Yeah,
have on a
it's
7-day
good.
antibiotic plan, and there should be minimal risk of infection. And if there is infection, well, luckily for you, you're in one of the most medically, technologically advanced institutions in the entire world. I'm sure we could figure that out.
There's a lot of rust on this table. I mean, I believe you. I believe your expertise. It's the facilities are.
Alright, Doctor is an excellent cleaner of rust with rags. It's 100% effective. Just a bit of this as well.
It's enough talk.
Just to be
Let's
sure.
begin surgery.
Excellent.
Okay, I'm going to need you to lie down on your back for this part. To go a little bit forward. There. Come a little bit forward. That works.
All right. So I just look straight up, or
It's a boy!
this right?
Look straight up.
All right.
Good.
Okay.
I'm going to inject the general anesthetic. Once I do so, I'm going to ask you a series of questions to make sure that everything is going well and you can still fully conscious and answer all my questions. Yeah?
Okay. All right.
Very well.
What would it
Tiny
mean if I
pinch.
answered
Well,
them?
hold on.
Ah, okay. That was not it. Tiny.
No. I still have to.
It's no problem, think of the trays and the bodies.
Tiny pinch.
Trees. Okay, there. Okay, tiny pinch. Okay, that wasn't a tiny. Okay.
Well,
And the ensuing emission.
we're all safe in the
Right.
It's perfectly safe.
What is your name?
Micah. I got it right. Right.
There.
My name? Micah. Micah.
It's Mika.
Smeke? Mickey?
Do you know the date?
Oh, what was the question? The date?
Hey, what date
What
is
if I get
it?
it wrong? It's April 7th.
If you get it wrong, we
right?
kill you.
Right?
I mean,
Oh, God.
nothing.
He's
No,
It's a
joking, right?
joke. It's merely a
He's
joke.
joking.
He's
Milo
supposed
has
to be a psychologist.
has an
Just
It's merely a
intricate
joke.
sense of humor. Don't worry about. No humor.
Just to distract you from the emission I said that could burn us alive.
No, we're in
But he's not going
There's no threat of being burnt alive. Today is a day of healing, not a day of hurting.
what kind of psychologist is he? What's his area of expertise?
I'm not a psychologist, I'm a surgical assistant at this moment.
Anyway, April 7th,
Excellent.
And the year?
2013, right?
Okay, and do you know what kind of procedure we're doing here today?
Yes. Cleaning up the broken parts of what's left of the eyeball and putting in a prosthetic.
Very good. It seems that,
perhaps.
and I'm going to have you move your head, and you shouldn't be able to.
Alright.
Very well. And then I'm going to. Can you feel this?
Yeah, I can feel that. I can feel that. Am I not supposed to feel that?
No.
Okay. What does it mean
Are
if
you
I
sure
can
it's
feel
not
it?
like phantom pain or anything?
No.
You don't like want to feel it? You can fully feel that.
No. Okay. Maybe it was pressure. Okay, I think we're good.
I mean, I injected the recommended amount for your weight, and
Okay.
I could give you more if.
Doctors, you could be lying about the weight in the head these people are.
I am just.
Push the way, Miss Mika.
I didn't feel anything.
Excellent.
He's suggesting that.
She's not feeling anything, she was lying. It's phantom pain.
Well, she is feeling something. It's going to be very painful. I would enjoy her. Would be appreciative if she would tell the truth right now before I.
I'm telling
Start
the
cutting
truth.
into it.
Telling the truth. Okay.
For this, you're feeling anything.
You have like an anxiety medicine or something?
Anxiety medicine?
Like a anxiety medicine or something like that?
Let me see here.
Because I'm feeling kind of anxious, so I'm afraid that I'm gonna pump blood faster and I'm gonna like lose all of my blood, whatever kind clotting?
There is some sedative inside these pickles.
No, not further pickles. She will be okay. She just
Alright,
needs to
no problem.
relax and let the professionals do their job.
Just relax and let the sands of the ocean breeze flowing through the trees allure you into a dull, calming moment.
There. So just to begin, I'm going to wipe on the bus of the affected area.
Imagine you're in French Polynesia if France was in a shithole.
Right. You know, you are good at being distracting, actually.
Imagine if you're in Bora Bora, where the water is so clear and the sun is so sunny. It should not concern us whatsoever. But you paid 6,000 rubles just to get there.
Speculum.
Huh?
The speculum keeps your eyelids open so that they do not shut on during the procedure. I'm not going to feel it, but just know that the eyelid is going to stay open for the entirety of the operation. Putting it in now.
Yes. Just imagine you're eating ice cream with a spoon. But it's a nice ice
I'm going
cream.
to make the conjunctival incision now.
Right, yeah, ice cream. Ice cream with a spoon, not
Ice cream with a spoon in Bora Bora, in French Polynesia, in Tahiti.
Right.
Excellent. You and your 17 children
Coconut. Like coconut.
drinking coconut juice.
The conjunctiva is open.
One of your children is floating around inside the pool in a floaty. The other 16 children,
Now?
other 16 children are on a walkabout on the local mountain in Rivavia. Rivavia across the ferry. And you're completely at peace.
Doctor, is he always so weird?
Just look at the images.
Yeah. These are the images of Bora Bora on the screen.
At this muscle, so superior is cut.
In front of you is a tropical paradise. You can see the coconuts in the trees and the beach on the left.
Yeah.
They're
Seems
not.
whoever
It's not a real
did
image
this
because the coconuts
damage
are
to
brown
you
and
already
green when tree. You're using
detached the
fake
sclera
images.
on your
Using fake pictures.
lateral
Crystal
medius
freak
muscle,
images, they're not real.
which is responsible for the movement of the eyeball, has been damaged.
They're as real as you want them to be.
We anticipated when we wipe off some of the blood.
Okay. Yeah, alright. So it's dripping down my
You're
face.
staring
Now going to work.
at your one child in the floaty in the
You
swimming
do
pool.
remember that the nurse took a lot of blood earlier, right? Like he took a lot of blood earlier.
Yeah,
How
but
much
it's
blood
nothing a
does it have
trip
again?
to Bora Bora could not heal.
So, more than enough.
Oh,
Your
that I
very
don't think that's exactly true. But okay.
human body is a lot of blood.
How many coconuts you see on the tree?
The bleeding.
7?
I'm now going to cut
Seven.
the
No, they're
optic
not.
nerve
None
and
because they
separate
can't
it.
be real coconut. Okay.
What you mean they're not real coconuts? Explain.
Applying traction on the
they
optic
can't-
nerve.
Because they can't be real coconuts because
Milo,
they
pass me the
look like the ones you
enucleation
find
scissors.
in the grocery store. They've got the husk taken off of them.
There you go.
It's fake coconut trees.
Scissors.
I bet
Thank
the
you,
whole
Milo.
island is fake. The whole...
It's no problem,
So these
doctor.
enucleation scissors are going to allow me to clamp the nerve and cut it open. That way we can remove the residual damage.
Mission, you're drinking the milk from the coconut on the tree on the right. Can you point out the furthest coconut on top of the tree?
No, but what was that about nerves? You're cutting the nerve now? You're cutting... Do you have to cut it, though? Are you sure that that's
And
necessary?
the damage is clear.
It's already
The
done.
entire eye socket completely open. Look at that.
No.
Half the procedure has essentially
didn't
finished.
even
However,
feel it.
now we need to regain homeostasis because I've cut a few blood vessels in the now so I'm going to use some slight cauterizing device to stop the bleeding.
Right,
not
okay,
much.
because I could taste there's blood. I think there's blood dripping in my mouth right now. That's a lot of
Not-
blood.
Then applying pressure. There we go.
Don't worry, we'll suction it.
Now
The suction
going to
device.
insert the prosthesis. Just
Okay.
is made of polyethylene. It's clear by substance. Remember, it is tempered,
She's getting
so it will not
excess.
either shatter or break on you. The worst case scenario is maybe it falls out during blunt force trauma or something like that, in which case
like a
it will not
trip
be
to the
anything
dentist.
and need to be reinserted with a
She's
further
getting the
surgery.
excess small bits of blood. It's nothing to worry about.
Oh, actually, I need to open up the tendons capsule again. It's just signing for something.
Alright. In this image here, you will see a black line down the center, and on the left, you will see a letter. What is the letter?
X. Supposed to be X.
Okay. I'm now going to alternate it between red and green.
Implantation.
What is the letter on the right?
I'm now going to suture the
On the right. B.
sclera, which should seal the implant shut.
What's the sclera?
The letter on the
Sorry.
right.
Oh, you said you were suturing the sclera. I was just wondering what that one was. What that's.
It's that white outer layer
Oh.
that closes over your eyelid. It's okay. I need it to be closed from now on because of
It's such a fantastic name
Made a
for a
slight
brand of
incision
motor vehicle.
to make insertion easier.
Which the letter on the right?
C.
C?
I see a C. C.
Yes, I'm asking you what you're seeing. Which the letter on the right?
It's a C. I see a C. Do you not see a C? What if I'm seeing a different? If I see a C and you don't see a C, then what does that mean?
It means you're almost there. Okay, we're going to alternate it again. I'm going to change the color from red to green. What do you say now?
I'm going to place a conformer in now, which is a small clear plastic shell. This is going to stay in for about an hour or two, so that no additional
Turquoise.
bleeding.
It's kind of a grainy green. It's not really turquoise. Maybe duck egg.
It isn't.
Maybe.
Milo, can you go ahead and put this bandage over the patient's eye? It's going to need to stay at the pressure dressing. Make sure to apply pressure. This will reduce swelling and bleeding.
Okay, petition. Okay, put down some of that.
So if I sneeze like really hard, is it gonna fly out and land in somebody's pasta or something?
Put the,
You know,
put the
like,
bandage on.
I'm just
Here.
wondering.
You're putting the bandage on?
Oh, should I put it on?
She put on the bandage.
Milo has put it on for you. You just need to adjust it. Yeah,
You just need to adjust it.
Oh, man. Oh.
You hit my funny bone. Ugh.
Okay.
Okay.
Milo has been kicked.
Oh, it's alright.
You know, I find it very strange that you're able to move. But that's alright.
She showed excellent resilience for someone who's on medication and surgery.
And actually lift up the bandage really quickly.
She lifted it up.
Okay, like that.
Here you are.
Oh, I can see it. Eyeball. Looks like an eyeball. Yeah,
That
looks,
is the goal.
Right, hey, it kind of moves with the other one. Nice.
That is why you reattach the nerves.
Oh, it's also...
Or the muscles more, not the nerves. There's no nerve system attached to your eye whatsoever. It has been completely damaged. So you will not feel anything, and there will be no tingliness in your eyes. However, you will be able to move the implant around when you move your other eye.
Oh, lovely. Thank you.
So that the conformer is going to stay on for about a few days. The bandage can come off once the swelling is sufficiently decreased, so we'll give it a few hours maybe. The conformer after 2 days will remove it. Think of it like a contact, and after that you could have some general discomfort, but it should be all good to go. I'm going to prescribe you an antibiotic cream. Go ahead and apply this around the affected surface for the next 7 days. That is the antibiotic plan.
Okay. Okay.
As well as some morphine, in case you feel any sort of severe pain, however, it shouldn't be too bad.
Okay.
Considering Roundhouse kicked the surgical assistant, your pain levels must be tolerant.
Look at that. We didn't have to use any of the trauma equipment I got to.
Well, I could use some trauma equipment. Which,
Oh, it
that's
doesn't.
good.
Rolling trauma equipment.
It doesn't. So what if I sneeze really hard? If I sneeze, is it gonna like pop out and
Why would sneezing pop out your
I don't know, like
eye
you feel
implant?
pressure when you sneeze. I don't know. Sometimes when you sneeze, you feel pressure behind your eyeballs. I just wondered if it would make it pop out and.
There's no pressure that builds up behind your eyeballs.
Okay. All right.
Not connected in any way, shape, or form.
The sinuses are connected, but Dr. Markov has securely fastened the eye to the rest of your body. It would take more than a sneeze. It would take an earthquake in your face.
In fact, the muscles are physically attached to the implantation. They would need the muscles themselves would need to get severed. You'd actually have a higher chance sneezing out the other eye before he would do that one because I've, fastened it
so
with
it's-
medical equipment.
I mean, is that something I need to be worried about?
No.
Until
It's like saying you're more likely to get struck by lightning than win the lottery.
Okay, I got it.
Considering you're in the zone, you have a lot more to worry about than your eye at this moment.
Yeah, but at least you look fine now, and if once you complete the research system program, you'll be able to reintegrate into society as if you never lost your eye in the first place.
You're 50% less ugly than you were.
Well, thank you.
Well, thank you. Needed simply doing my job for a hard-working research assistant of the college's organization. Now I'm going to let Milo escort you back to your bunk, where I recommend you get some sleep. I'm going to clean up in here.
Please follow me. Please pick it up your.
And the painkillers. You should probably bring that with you. I've gone
Sure,
ahead and
sure,
applied
sure.
the first dose of that, but go ahead and every night, every morning, every night, or whenever you feel any sort of discomfort, go ahead and apply it.
Okay, understood.
Do you have any questions?
No. So if I feel.
Oh, I completely forgot. There's actually one more thing. I've gotten you a pair of glasses. You're going to put these on as soon as the bandage comes off, because now what happens is your depth perception is going to be completely up, because your mind is going to think that you have two eyes, however you only have one, so it might mess with your depth perception a little bit. You're going to put these glasses on that should fix any and all optic problems. You only have to wear them for about a week or two before you get fully adjusted to your eyesight, and then it should be completely fine. I hope there's no issue with that.
Yeah.
Now you're only 25% less ugly. Glasses are stylish.
You will not call the patient ugly. I can get you fired for that.
Yeah.
You did not hear that.
Oh, I heard it.
Well, you're the intended recipient.
Ow.
Make sure you take your time. I get this. Yes, okay. Excuse me, like.
So he said that I'm more likely to sneeze out my other eyeball than the one that he put in.
Exactly. And I almost sneezed at the sun eyeballs. But they're intact. Any side effects from the rain? Any weird sensations?
Any, well, yeah, it feels. I mean, if it feels like kind of like warmer or heavier than usual, does that mean that something's gone wrong?
It's just the swelling.
Alright.
Right, you rest and relaxation and
Alright.
think about
Yeah.
French Polynesia and Bora Bora. The
Alright,
17
I'm gonna sit
children.
under here, I think.
Excellent.
I'm just gonna lay down. Night.